topic is Myasthenia gravis. Myasthenia gravis, it is an autoimmune disease. So myasthenia means a muscular debility and gravis means serious. So myasthenia gravis, it is a serious muscular disease which affects day-to-day life of a patient. So first of all, it is an autoimmune condition that affects the communication between the nerves and muscles. So what is the communication between nerve and muscles? To understand the communication between nerve and muscle, we should know about a neuromuscular junction. So this is a neuromuscular junction. In neuromuscular junction, we have a nerve ending like this axon. So this is our presynaptic terminal, and then we also have a muscle fiber. So this is their junction, and there is a gap between nerve ending and muscle fiber. This gap is known as synaptic cleft. So this is our synaptic cleft. So normally how nerve and muscles they communicate. So in this presynaptic terminal, we have different vesicles that contain acetylcholine. So acetylcholine is a neurotransmitter. So when person wants to initiate a movement, it receives impulses from the nerve. So the nerve fiber will release its acetylcholine into the synaptic cleft, and then these neurotransmitters like acetylcholine, it will come and attach to the acetylcholine receptor which is present on the muscle fiber. And when this acetylcholine it attaches to the muscle fiber acetylcholine receptor, this connection results in opening of ion channels. For example, sodium ion channels they are open, and sodium ions they move inside the muscle fiber. There are different like electrochemical and ion changes will happen inside the muscle cell, and finally it will release the calcium from the sarcoplasmic reticulum of the muscle, and this released calcium it will bind to actin, and finally the muscle contraction will take place. So for the muscle contraction to take place, this all system is very important. This neuromuscular junction and acetylcholine receptors, so this is all is very important. And now we know that in this myasthenia gravis, the communication with this communication which we have seen now, this communication between nerve and muscle, it breaks down and result in myasthenia gravis. Antibodies. Autoantibodies are the antibodies that start attacking person's own body cells or body antigens. So these are known as autoantibodies. So this myasthenia gravis is also an autoimmune disease, and in which different antibodies are produced, and what these antibodies do, they start destroying or affecting the acetylcholine receptors. For example, these are the antibodies. They will in myasthenia gravis, they will come and bind to these acetylcholine receptors, and when these bind, so it means they will whether they will destroy the receptors or they will produce other different effects, but come and bind to acetylcholine receptors, so that now our normal acetylcholine it cannot bind to these receptors. So only few acetylcholine receptors are left to which acetylcholine can bind. So that is why the myasthenia gravis patient finds it difficult to carry out the muscular activities. Now, because only a few receptors are left behind in a myasthenic patient, so that is why not all acetylcholine can bind to the receptors present, because receptors are already occupied by the autoantibody. So that is why acetylcholine receptor function is decreased. And now we have seen that this junction, acetylcholine receptor, acetylcholine, these all things are very important to carry out a muscular movement, because this all system is affected. So patient suffers with fatigability, right? And patient suffers from painless weakness of skeletal muscle, because acetylcholine present do not have many available receptors. So therefore patient suffers from weak muscles. Patient will give you history of the in the morning the patient feels good, and he feels energetic. But when he do his daily work for 1 to 2 hours after waking up in the morning, then slowly and gradually his energy and muscular function decreases, and patient will start feeling fatigued or tired, or his muscles movement would not be very good. This will be our patient's history. And then again, if patient would rest for 1 or 2 hours and then again start working, again he will feel that his muscle strength has improved. So basically muscle strength will improve with the rest. The contraction is progressively weaker. Like at the start, means at the start of the day, patient would feel that his muscle contraction, his muscle activity is good, but slowly and progressively as the day passes, in 1 to 2 hours, patient would start feeling fatiguability, and patient would find it difficult to carry out his routine work in routine life. So in this disease, what are voluntary skeletal muscles are affected. So first of all, the first symptoms are diplopia and ptosis, because patient's orbicularis oris muscle, it is also an voluntary muscle, it is affected, and patient finds it patient would suffer from drooping eyelids, that is ptosis, and because of this ptosis, patient could also suffer from diplopia, that is double vision, and these are among the first symptoms of the myasthenia gravis. Then our oral muscles or speech muscles are also voluntary skeletal muscle. So patient would also feel dysarthria, dysphagia, means patient would find it difficult to chew the food, to swallow the food. Patient would have difficulty in these movements. And dysarthria also means patient would suffer from slurred speech. Then the muscle weakness is more profound in arms or upper limbs than in the lungs. And in severe cases, respiratory muscles could also be get affected. If respiratory muscles are affected, so patient would find it very difficult to breathe. This is known as myasthenia crisis, and patient needs to be hospitalized for this emergency so that his breathing can be supported. Also, the expressions of the person would be affected, because expression muscles, facial muscles are also affected, so patient could have a mask like appearance. Patient would also find it difficult to hold his head up because of weak neck muscle. So these are all the history points or the symptoms of the myasthenia gravis. So now how would we diagnose myasthenia gravis? We have few tests. Number one is hydrophonium tests. We know that we have a neuromuscular junction where we have a nerve ending and a muscle fiber. And muscle fiber have acetylcholine receptors, and nerve ending releases many as neurotransmitter acetylcholine, which is a neurotransmitter. But in myasthenia gravis, the receptors, they are attached with the autoantibodies. So that is why we do not have many receptors available that can bind acetylcholine. So we need a greater concentration of acetylcholine that can bind to these receptors. We have an enzyme, an acetylcholinesterase. This enzyme, it degrades the neurotransmitter acetylcholine that is present in the synaptic cleft. It degrades that acetylcholine. So we will inhibit this acetylcholinesterase enzyme, and when this enzyme is inhibited, it will not degrade our acetylcholine, so that acetylcholine concentration in the synaptic cleft of the patient, it would improve when we will inhibit this acetylcholinesterase. Because acetylcholine concentration would be increased, the patient's symptoms would be improved. So hydrophonium is this acetylcholinesterase inhibitor. So to diagnose this condition, we will give a shot of hydrophonium to the patient, and patient would respond very good to this hydrophonium test, and his condition would be improved a lot. So we would say that patient was suffering from myasthenia gravis. We have his ice pack test, that we would apply an ice pack on the patient muscles, skeletal muscles, and we would see that patient symptoms would be improved, because neuromuscular transmission, it improves at lower temperatures. So this is also a bedside test. We also do patient's neurological exam to evaluate its muscle strength, tone, eye movements, coordination. We also perform these tests. Then we also do blood antibody tests so that we can detect the autoantibodies that are present in patient's blood. For example, like we can find antibodies that are against acetylcholine receptors. We can find antibodies that are affecting muscle specific kinase proteins. So we can find different types of antibodies in the patient's blood. We also do electrodiagnostics, like we do EMG and with single fiber electromyography. It is the most sensitive test to diagnose myasthenia gravis, and it measures impaired nerve to muscle transmission. We can also do repetitive nerve stimulation test. We will see that if we stimulate a same muscle again and again repetitively, so we will see that the electric signals to the muscles, they will decrease, and it will result in the muscle fatigue, and the reason behind it now we have seen. We can also do CT scan or MRI of the chest, because we have seen that many times this myasthenia gravis is associated with thymus hyperplasia or thymoma. So that is why we would do CT or MRI to evaluate the thymus gland. Risk factors for the myasthenia gravis is of course genetics. If person has a family history of autoimmune conditions of myasthenia gravis, so that patient is at higher risk. The thymus gland issues, like enlarged thymus gland or thymoma in a thymus gland, so those person who have thymus gland issues, they are at increased risk of myasthenia gravis. And it mostly occurs in women aged less than 40 years and men more than 60 years of age. So these are all the risk factors for myasthenia gravis. Then there are some factors that can make myasthenia gravis worse. For example, fatigue, infection, illness, surgery, stress, few medications, pregnancy, periods. So these factors can increase the severity of myasthenia attack. For complications of myasthenia, we have studied now myasthenia crisis, that when in severe cases, if our breathing muscles are affected, so of course person would not be able to breathe properly, and he would need hospitalization, and his breathing would be difficult. So that is a life-threatening condition, myasthenia crisis. We can find thymus gland tumors in a myasthenic patient, and because since it is an autoimmune disease, so other autoimmune diseases can also be present in this patient. For example, SLE and so many other autoimmune diseases can coexist. Now comes the treatment for myasthenia gravis. So first we have cholinesterase inhibitors. I have told you that we have an enzyme called acetylcholinesterases in our bodies that degrade the acetylcholine that has been released from the nerve endings. So this acetylcholine is destroyed or degraded by acetylcholinesterase enzymes. So because in this disease, to improve the patient's symptoms, we want to have more and more concentration of acetylcholine neurotransmitter available in our synaptic cleft, in our neuromuscular junctions. We need more and more acetylcholine concentration. So that is why we will inhibit this enzyme which is breaking down the acetylcholine. We will inhibit this acetylcholinesterase. So we will use acetylcholinease inhibitors, that is pyridostigmine, mestinol, regonol. So this is our treatment. Because it is an autoimmune disease, so we can also use steroids. For example, prednisone. So these steroids, they just suppress our immune systems, because it is an autoimmune disease. So when our immune system is suppressed, so the disease symptoms or disease is also suppressed. We can also directly use immunosuppressants, for example, azathioprine, mycophenolate, cyclosporine. So immunosuppressants are also involved in the treatment of myasthenia gravis. Another treatment option we have is plasmapheresis, because we know that patient have autoantibodies present in his blood. So we would filter the patient's blood so that those autoimmune antibodies are removed from the patient's blood. So this procedure is plasmapheresis, but side effect is that it's not a definite treatment and we have to do this treatment every few months or every few weeks depending on the patient's condition.